In 2014, the Foreign Affairs Ministry published an advertisement on its website seeking applications for over 200 health professionals to work in the Caribbean country of Trinidad and Tobago. Amongst those being sought were holders of a master's degree in gynecology, obstetrics, pathology, forensics medicine, ophthalmology, among others. However, the announcement drew a backlash and flack from Parliament and watchdog organizations. Government buckled under pressure and rescinded the decision to export health labor at the time Uganda lacks specialist health workers and is grappling with an ailing health sector. The chairman of the Uganda Medical and Dental Practitioners Council, Professor Joel Okulo, says this decision was flawed.
And to think of exporting not just the general doctor but the specialist, I think is madness. The fact that the impact that it would have on the provision of services in this country is immeasurable.
This would have been one of the biggest government health workforce export on the African continent, where there is only 3% of health workers and less than 1% of the world's financial resources to deal with the problem.
The total number of obstetricians and gynecologists in this country who are registered with us is something like 180. The surgeons is about 150. The anesthetists, I think they're about, 20? Now, if you take those away, what are you going to remain with?
Dr. Katumba Sentongo, the Uganda Medical and Dental Practitioners Council Registrar at the Health Ministry, says there are no current statistics on migration of health workers.
The documented people annually is about 100 and 150 people who are living in this country.
The General Secretary of the Uganda Medical Association, Dr. Ekwaro Obuku, explained what this migration entails.
There is the migration internally, moving from the rural areas or health facilities to the urban areas or the Kampala areas or the central areas. And then there is moving out of the country to African region, Kenya, South Africa, Botswana, etc. And then there is moving abroad to the OECD countries, North America and Europe.
A 2007 study conducted by the Ministry of Health on the same matter found that most of the medical personnel that leave are destined for countries like Rwanda, South Sudan, South Africa, Kenya, and countries in West Africa during the Ebola pandemic. Those who go abroad find conducive environment in North America and the United Kingdom.
If someone who is supposed to make the operation successful, the anesthetic officer puts you to sleep, for example, okay, is not there, then you cannot utilize all your skills, and that can account for loss of motivation to stay.
In most of the countries, you find there are people who are being pushed out because the working conditions are not good.
And these are the kind of things that impact on the job satisfaction of the health workers. If you cannot get the basic things that you require to do your trade, job satisfaction is going to be zero.
A 2016 report by the Association of Medical Councils of Africa, AMCOA, points to poor remuneration as a factor that African governments should deal with.
If you look especially at the public sector, we find that just about 60% of the establishment for doctors have been filled. That means that there's still quite a lot of doctors that are required to be deployed.
A 2015 research shows how grim the situation is in Uganda. A medical doctor in Uganda earns $700 US, Kenya pays $1,400 US, Ghana $1,200 US, South Africa $7,200 US, UK and Canada $12,000 US, and USA pays $15,000 of its dollars.
Being an MP is now a better job, yet it's supposed to be a service to the community. So these are some of the issues which, as a doctor, if you observe, you say, what, I think I've had enough of this. I need to go where the environment is sane, where I'll be respected.
In the Ministry of Health itself, if one were to go there and dig out how much of the money that is meant for health is actually stolen, you would want to hang yourself.
Dr. Okulo says the government's decision to decentralize the distribution of doctors at district level causes an ease which leads to labor flight.
What has tended to happen is that, one, the local governments want to hire certain types of persons. Of course, I don't know what the argument is, but does that bring in quality of service? And I think the case that you are quoting is, this doesn't belong to this place. It's taking away the job for our locals.
Migration of health workers piles an enormous strain on the health system. If not catered for, it can lead to loss of investment to the country.
We are getting losses of people who have not been deployed and have gone to other trades.
And for somebody to think that we cannot employ them, that we can send them out to other countries, I think is, as I said, is totally missing the mark.
In 2010, the World Health Organization adopted a global code of practice on the international recruitment of health personnel. This aims to establish and promote voluntary principles and practices for the ethical international recruitment of health personnel and to facilitate the strengthening of health systems. Dr. Katumba says the government is introducing bonding as a way of retaining health workers trained in Uganda, among other methods.
I think it's a positive thing if the details in there are well thought out.
We are aware of what the crisis is, we are aware of what needs to be done, but somehow we don't get it done.
Walter Mwesije,